Sitaram, and a pleasant good morning to all of our viewers and listeners, and welcome to another edition of the program Addiction and Recovery. I am Jason Kalu, your moderator this morning. It's a wonderful Thursday morning here in Trinidad and Tobago, Sitaram, and a Bhagwan stresses blessings to each and every one of you, whether you're tuned in here at home or across international waters. Welcome to Addiction and Recovery. So join me as we welcome the host to Addiction and Recovery, Mr. Ramners Dwarka. Sitaram, ji, sir.
Jason, and thank you very much for having me on the program again. And let me join with you in welcoming all our listeners, both here in Trinidad and Tobago and worldwide, who joined this program. And I want to remind our listeners this program is interactive. Of course, if you have a question, you can call in and we will take the question. If you have a brief comment, we will also engage that. And I want to remind our listeners this program is also repeated at 10 p.m. tonight on the same station. And it is also going to be posted shortly after the program on YouTube and Facebook. So those of you who are unable to listen to the program in its entirety, you can go back and refer to it and listen to it at your convenience. And these programs are being posted in the various media platforms so that any listener out there who has a sibling, who has a relative who has a problem with alcohol or drug addiction, you can refer them to these programs. All you have to do is type in my name, Ramnaresh Dwarika, as you see on the screen, and you will be able to access all the programs. There are programs there from the very start to help you identify whether you're an alcoholic or drug addict. Because a lot of people have problems with those, Jason, deciding whether I am alcoholic or not. And if you have identified, if you think you have a problem, then there are programs there on YouTube as well on Facebook that will guide you to how to select the proper treatment intervention method. There are also programs that discusses the various challenges one might encounter in trying to remain sober. The whole question of withdrawal symptoms are there. And there's also a brief discussion on the various programs of recovery and treatment methods available, especially Alcoholics Anonymous. There's a whole program discussing the 12 steps, principles by which people in Alcoholics Anonymous and Narcotics Anonymous are able to not only stop drinking or stop using drugs, but also be able to stay stopped and be happy as well. So these programs are there as a resource for anyone out there. It is also something that a lot of my callers are calling and saying they're using it as a springboard to start discussion with their family, with their teenage children. They go to the program, they open it up, they listen, and then they discuss it and get the views and opinions. This morning I was speaking to a person in my neighborhood here who has a teenage son, and he was describing, these are methods that one can use to get to know what is operating in the mind of your children, what positions they hold on certain issues, especially when it comes to drug addiction and so on. It is also important to find out, what their friends think, because the peer group exercises a lot of influence on young people at that age. So I am saying again, for those of you who cannot listen to the whole program in its entirety this morning, you have this resource that you can go to. And of course, if there are questions arising from any one of the programs, you can post your comment or you can call me at the number described on the screen here, 671-3040, and you can also ask directly. So concerning the videos this morning, those are very good examples of intervention methods. We are very fortunate in Trinidad, Jason, that most of I know the government of Trinidad and Tobago, the Ministry of Education, some of the large corporate citizens as well, corporations, they have employee assistance programs. They have employee assistance counselors. I myself am a trained employee assistant consultant, and I have done consultancy work for several corporate citizens, the Port Authority, the Airports Authority, I have been doing consultancy when ISPAT was here, the University of the West Indies, and several organizations. Rather than it is a waste really to have workers who you have invested so much in terms of time and experience and training. So much has been spent to hone their skills. And now, because of drinking or drug use, you're losing this employee. It's really a great loss to the company and to the industry. So that it has been found that, when the employer speaks to these people, they have a greater tendency to listen because the employer wields a particular influence. The employer can stop your salary, they can relieve you of your job. So, whereas alcoholics and drug addicts may not listen to parents or siblings or spouse, but when the employer says, hey, you go do something about your drinking, they listen. When the magistrate says you go and get treatment for your drinking, otherwise you will not get your driver's license anymore, they listen. So people in these positions, they exercise a very unique influence to get people to go initially to seek help. And eventually, when these people come for counseling or come to Alcoholics Anonymous, a lot of them eventually stay and they change their whole life around. As I say this, I also provide a counseling service. I also am an acupuncturist. And I want to make reference again to the video. I know that the first line of defense for most people when they have a drinking or drug problem, they go to the doctor. And if it is really chronic, if they are in chronic withdrawal, and that is to say, they are starting to have hallucinations and depression and anxiety and all of those things, they may be referred to a hospital. Now, the bottom line here is, and I have worked in most of the hospitals in Trinidad. I worked at the ward 8 of the Port of Spain General Hospital. I worked at a lot of the wards at St. Anne's Hospital. I worked at Cora Hospital at the Substance Abuse Prevention and Treatment Center there. And I've also worked at Ward 1 of the San Fernando General Hospital. And I'm very walk around with what happens there. Now, fact of the matter is, in hospitals, the first line to deal with the withdrawal symptoms, the doctors will prescribe psychotropic drugs. They may prescribe tranquilizers or sedatives because one of the major withdrawal symptoms is insomnia or depression or anxiety when a person is coming off these drugs, alcohol in particular, or in the case of marijuana, there may be drug-induced psychosis, in which case medication, will have to be prescribed to stabilize the patient, to help them to sleep, to help them to come out of the depression. And there is a place for the use of drugs in the treatment of drug addiction in those extreme cases. However, practitioners have to be aware that there's a risk that you may be substituting a prescription pill for the drug of choice, for the drug that is being abused. And the substitution is not really a treatment, it's not a cure. So when these drugs are prescribed, they have to be managed very carefully. It is just to be used to wean the person and to stabilize the psychiatric symptoms that you're seeing, the insomnia and so on. But my experience has been a lot of people, Trinidadians, we are a little too smart for our own good. We look at the name of the drug and then we don't go back to the doctor. We go to the pharmacy and we find pharmacies that are, willing to sell us the drug under the counter. And then we end up with a bigger problem. And I have in my practice here, because I use acupuncture in the treatment of drug addiction, you cannot get addicted to acupuncture. You cannot become dependent on it. And actually, it had been used, it was introduced when I was there at Cora Hospital and was used very effectively to treat most of the withdrawal symptoms. And I would like to recognize the support of Dr. Peter Lewis, who took responsibility for the acupuncture program at Coro Hospital, and to also recognize Professor Berbrand, who's had been an authority in the Western Hemisphere when it comes to alcoholism and substance abuse and the treatment modalities and so on. And Professor Berbrand had introduced the use of acupuncture in the treatment of drug addiction. In fact, he had invited me to become a resource person with the Caribbean Institute on Alcoholism and Drug Addiction, where I served voluntarily for about 28 years. I was a resource person with that institute. And every year I would do presentations on the use of acupuncture in the treatment of drug addiction. It was well received. In fact, I had the opportunity to train many people, both in Trinidad and Tobago, doctors included, and people of the Caribbean chain who were involved in the treatment and management of drug addiction. I have also trained the counselors and therapists at New Life Ministries in the use of acupuncture, and they still continue to use it there because acupuncture has been found to be very effective in treating. It is very cost effective as well, and it has been found to be very effective in dealing with the withdrawal symptoms associated with alcoholism and drug addiction. It is not a cure for drug addiction, let me say, but it is a very useful adjunct. In my practice here, I use acupuncture to stabilize. In fact, after this program, I would be having patients coming who would be having acupuncture treatment to help them with the management of their withdrawal symptoms. Because anyone who had been using alcohol or drugs for a long time, especially if they are over age 40, they tend to suffer with severe withdrawal symptoms when they try to stop. And I have met so many people who have come to me for counseling, referred to me by companies and individuals who I know they are very highly motivated. They understand the role drug has been playing in their life. They want to stop, but because of the withdrawal symptoms, they were not able to. Because for those people who have never used drugs, Jason, you know, they say the donkey that is carrying the load know the weight. So too, people who use drugs, they understand withdrawal. It is not a pleasant experience because eventually a lot of people start using alcohol to self-medicate. That is just like patients would be prescribed psychotropic drugs to help them to manage their depression and their anxiety and their insomnia and all of those things. So too, they learn over time that they could use alcohol, which alcohol is a very powerful sedative, so that it helps you it is mood altering. And this is why people become dependent after a little while you're a social drinker and you're enjoying it and so on, and you're in the beginning phase of alcoholism, it is the withdrawal symptoms are not as acute, but they creep up very subtly, and the person is unaware, and only to realize, look, when I'm drinking, I just feel out of sorts. And then eventually they start having the shakes. That is, next morning they can't sign the attendance register unless they take a drink. Or they can't hold the tape the carpenter can't hold the tape to measure correctly. You understand? Or climb the scaffolding. You understand? And then that is a dangerous thing because to drink and climb on the scaffold. So eventually by then, you'll find a lot of experienced contractors and carpenters hiring younger people, and they staying on the ground and just directing the work because they can't climb the scaffold anymore. And so it affects everyone, the crane driver on the docks. And these people can become a danger to the people around them because can you imagine you in the hold of a ship and the fellow operating the crane who picking up all these heavy, skids and all of that from inside the ship. He is hallucinating or he's in withdrawal, he's shaking, and his judgment is impaired. The rest of people who are hooking up the skid could be in danger. And so in every way of life, can you imagine a surgeon who has to do surgery the next day on you, Jason, to maybe take out your appendix or your tonsil. He can probably end up taking out more than he had bargained for. You understand? So that while we, and I say that, when I think about, we have very liberally went ahead, supplying the various brands of alcohol in society and promoting it. And then we have recently, decriminalized marijuana, making it more accessible and less of a problem to receive it, to have it. You understand? So that under social pressures, I know the policymakers, politicians as well, especially, they don't want to antagonize any large group of people because their whole their future and their career depends on the support from the society. So they have a tendency. We can't really blame them as much as we need to take responsibility ourselves. And this is the reason, this is the basis for this program, Jason, to educate our brothers and sisters out there. It is so easy to point fingers, at doctors and politicians and everybody else. But the beginning of doing anything about your drug addiction is taking responsibility yourself. If you are going to prevent yourself or children or family, you're going to save them from this dreaded disease that it is, you need to educate yourself. And this is what this program is about. So that, coming back to what was mentioned in the video, I would want to say that, it is common sense should tell you you can't use drugs to treat drug addiction. What you would be, you're putting in the patient at risk. Although drugs may be used initially to stabilize the patient, but a better option has been found to use in the use of acupuncture, because you cannot get addicted to acupuncture. And acupuncture don't give you a high, but if you are depressed, it brings you into balance. And it not only treats with your psychology, but it also treats with your physical attributes. It brings the body into balance as well. So there's a general sense of well-being. People who have had acupuncture, immediately after your first treatment, you are able to sleep better, you're able to eat better, you start feeling more relaxed, you're not depressed, you're not as anxious and irritable. And these are all signs, classic signs of withdrawal. So I thought, coming out of the videos this morning, I wanted to mention those things, that, we have facilities available because of the stigma associated with alcoholism and drug addiction. A lot of people don't like to go for counseling, or, or go to public meetings, AA meetings, and so on. But even that is changing. Now we have online AA meetings, and I have seen a tremendous difference, Jason, since that's one of the good things about COVID. We started doing things online, and even yesterday I was hearing a lot of people talking about, now because of the heat, staying at home and working online and having to beat the traffic and go and stay in these very hot environment. So because of the COVID, we started online meetings, and a lot of women who would never have gone to an AA meeting, a public AA meeting in a school or a church or where they have it, are now coming to meetings online because they can stay in the safety of their home, and they can access it, and they can remain anonymous. They don't even have to put their picture. They don't even have to put their correct name. So there's a certain amount of safety, but they get genuine information and guidance as a result. So sometime out of chaos, a lot of good things happen. And as I speak about women, this morning I had intended, and I still will probably start that topic, because the issues relating to women, alcohol and drug abuse is very different to men. Yes, men generally drink more alcohol than women, but that is changing, Jason. As women have entered the world of work, and they are now having their own incomes, increased income among the women population. You know, the drug companies have been doing their research. They've been paying attention. Here's a whole new population of people who have disposable income, and they want to get some of that. You understand? So if you notice, and I'm sure you have noticed, you being in the media, Jason, you would have noticed that a lot of ads in the other stations have been coming out now to target women. You remember that one with how to let your hair down and all of that? And if you drive around, and I'm sure you would have noticed it, the old rum shops, what we used to call the old rum shops, are now extending patios right up to the pavement with high stools and high chairs and tables, and women are sitting right there as if, look, to make a statement, our time has come. And as a result, we are seeing more and more women becoming addicted because women, their body is not able to metabolize alcohol as efficiently as men generally. Although women will not agree with me. There are some women who could probably drink the average man under the table. But generally, women tend to get drunk more quickly and tend to become more affected. And the issues for women and alcohol is a little bit different because remember, women carry the baby. Women have their monthly periods. Their body makeup is a little bit different. So alcohol and drugs are going to affect them differently. In the world that we live, Jason, from the time you were born and you exit and you come out and they look at you and they realize, you're a boy, you get to wear blue. And as soon as they realize you're a girl, you get to wear pink. And those discrimination, those ascribed roles follow the person for the rest of their life. Men are men and women are women. And the expectation, there's a heavier expectation on women, Jason, where men could drink and fall down and sleep by the rum shop. Women cannot do that. They get branded and labeled in a more stigmatized manner. I was informed by a study done by our own Dr. Sandra Ree here in Trinidad, and she did a study among medical students at the time at the university here, and she asked them to, you know, what words come to their mind when they think of a male alcoholic. And they in the research they put, bound to drunk, skid row, you know, and names like that, vagrant, things like that. But when she asked them to describe a female alcoholic, you know what they were saying? They were saying prostitute and scatel and things like that, because women are seen to be different. The yardstick, the liberties meted out, that's simple to understand. In a household, the boys are allowed to stay out later and play outside. The girls before dark have to come inside. There's two different measurement for each one. But that is changing because with the liberal movement in the world, women are entering the world of work. They're seeing themselves, well, look, I am equal. And they are. And they expect that they will have equal privileges. So whereas in the past, women tended to become closet drinkers and were tended to be using prescription pills, other substances than alcohol. Because, alcohol is very obvious. When you drink alcohol like in the ad, people around you can smell that you drank. They can see that you drank. But women were able to use, sedatives and tranquilizers and marijuana and all kinds of other drugs in a much more secretive way. And as a result, they found it more attractive. So that I was looking at a research by the National Institute on Health and coming out of the National Library of Medicine in the US. And what they are saying now, recent research is showing that men and, in fact, women have been more prolific at using the other drugs except alcohol than even men. They were hiding and using it. And what jumped out at me this morning, something that I never really paid attention to before, even though I'm involved in the field of addiction for a long time. This came as a novelty because, women generally, they young teenage girls, they tend to date older boys. And the older boys have already started using the marijuana and the alcohol and the cocaine and all those things because the mean age for marijuana use, even here in Trinidad, Jason, is 17. That's the average age. A lot of men, boys, start using before that. But on average, when you check the whole population, that would be about the average age for marijuana use and the other illicit drugs and so on is 17. Alcohol is still averaged at about 35 because it's legal and you could drink it anytime you want. And a lot of people, and because of the obvious nature of it, a lot of people don't find that they are drinking much alcohol at an early age, although they may start. It takes a longer while because alcohol is not as powerful as cocaine and the other drugs. So what I found interesting this morning reading that research is that now these younger girls generally date someone older than themselves. That's the natural pattern. So the male partner, he's already introduced to some kind of drugs. And 90% of the time, he will want to introduce his girlfriend to it. Because that way, he there's a saying, misery likes company. So a lot of girls were introduced to marijuana and cocaine and eventually alcohol by the boys who they dated. So this has implications for parents. If you have a daughter out there, you want to know. They will tell you, well, yeah, he just take a drink occasionally, but that's a red flag because he is going to try everything because she goes to him wherever he goes, the parties and all of that. And if he's drinking there, he's going to offer her a drink. And women are more susceptible. They can't handle it as much as, and remember, women are the people who bring the children into the world, one. And yes, the research has shown that women who use alcohol, the baby, the fetus, tend to be affected. Not only alcohol, marijuana and cocaine and all of these psychotropic drugs will affect the fetus. In fact, even if it's a prescription drug, this is why pregnant mothers, they have to be very careful. We don't have any prescription pill as it is right now that can safely detox a pregnant mother. The only method that I know uh, that is available is acupuncture, which can detox a pregnant mother without affecting the baby. Acupuncture also has an advantage where counseling cannot reach the mentally ill, chemically addicted person. The acupuncture does because you don't have to believe in it. It's not like church or counseling or any of that. Whether you believe in it or not, once you put the needle in the right place, it's going to have the effect. The person is going to, it is going to help them to reduce the withdrawal symptoms and all of that. There again, and of course, it is one of the cheapest methods. When we use it at Cora, it was estimated it will cost 3 cents per day to treat a patient, where it was costing like about 17 or $1,800 a day to treat with the other methods, considering the salary of the doctor and the nurses and all of those people. So one would wonder, the question is still out there. Why is it we're not still using acupuncture in all our hospital and health systems? Well, that's a question for you to ponder on, Jason. You understand? I know the answer for that because I have been banging my head against so many rock and hard places trying to get it introduced because there appears to be a professional jealousy there. There seems to everything that is not going to bring money is going to be knocked down. You understand? This is why a lot of herbal medicine is being rejected. And I feel pretty certain that we have effective remedies out there for every one of human health conditions. But because Big Pharma will not make a penny out of it, you don't hear about it. In fact, there have been instances where people have been obliterated, because they discovered something that could empty the pockets or prevent the profits from being made. I myself have had a little taste of that in my own sojourn in the health situation. I've had senior officers who wrote threatening me that I should not do acupuncture when I was at Cora Hospital because it was not on my job specification, that I should cease and desist. But I a little too stubborn for that. I challenged the system, and eventually, as I mentioned earlier on, Dr. Peter Lewis had been to uh, a seminar way down in South America, and there he heard about the use of acupuncture in Europe and in North America, and he was sufficiently informed to come back and says, "Listen, I am taking responsibility." And after that, we had no problem at Cora. Everyone, the nursing assistants and the nurses and everyone, the doctors too, were training themselves in the use of acupuncture, and we were using it. There was an introduction at St. Anne's, but unfortunately, most of the people who were trained, the effort was not sustained. And now we've gone back to square one, where there are doctors who would prefer not prefer to use acupuncture, but rather go back to chemotherapy with its attendant issues. As I said earlier on, yes, there's a use for chemotherapy in treatment, but there's a additional risk. In fact, yesterday, a parent called me whose son is a doctor. And he started using, of course, sedatives, sleeping pills to help him because, when you're waking late and getting up early and you had to beat books every night. And this is not the first instance. I've had quite a few medical professionals who, because of availability, that is one of the main reasons people use drugs, availability. If you don't have it, you can't use it. So they get introduced to the knowledge, how you can use these psychotropic drugs. They see how effective it is, and then they start to use it because it's available. And yes, so when you take the sleeping pills, nobody smells them out next day. You can go attend your ward rounds and nobody is any wiser, and you would have slept mechanically. As soon as you take it 5 minutes after, you sound asleep, and then you take one to wake you up in the morning. There are those stimulants as well. So one to sleep, one to wake up, and then you're burning the candle from both sides. And then what happens? With time, your body develops tolerance. Where 2 milligrams used to put you to sleep, after a little while, you need to take 5. And then eventually, you have to take 10, and then 15, and then 20. And you reach to a point where no amount is working. You're realizing, hey, I'm going over the cliff here because I'm taking too much, because when you take it, the heavier the doses, the higher the withdrawal. Next day you're a mess. You can't function. So you have to take it during the day now as well because you are in withdrawal. And when you take it while you could perform, but you're sleeping away on the job. So, and then for people who do not have access, they start supplementing it with alcohol. So you're taking the sleeping pills and you're taking the alcohol as well, to supplement it. When the sleeping pills didn't put you to sleep, now you have a double header devil to deal with. And that is a very I'll tell you something, it is easier to come off alcohol and the illicit drugs, but it is several times more difficult to come off prescription pills, Jason. Because prescription pills, they look very innocent, very small little tablets. But boy, those little things can put an elephant to sleep, They're several times more potent than the whole bottle of rum you'll drink. So people, they underestimate the power of that little sleeping pill. But when you take sleeping pills, you don't really sleep, Jason. You don't have a natural sleep. It's like I took a 2 pound rope and I tie you down to my cot here, and all night you were struggling, your body's struggling to neutralize the sleeping pills. And next morning when you get up, yeah, you think you were asleep because you were unaware of what was happening around you. But next morning you feel like about 10 people beat you up. You're feeling your whole body like it's mashed up, and you're trembling and you're nervous and your mouth dry and your throat dry and you're in severe withdrawal. And that's when some people now will start taking something else. You understand? And a little knowledge is a bad thing, if used in the wrong way. So people who are educated in the field, doctors, nurses, and so on, who know the effect of these things, they know, well, look, I could just go and take a pill and I'll be all right. And you start going down a road, a slippery slope that you can't climb up back. I want to let people like that know that help is available. I have helped so many people who had become addicted to prescription pills. Jason, it takes a little while, but acupuncture can do it. Acupuncture can do it. I've had people who have been addicted to all kinds of prescription, legal and illegal drugs. And I've used acupuncture to help them to deal with the withdrawal symptoms. But like I said, it is not a cure in itself. It must be done in conjunction with counseling, because you have to teach the person who had become dependent on the alcohol and the drugs to feel good about themselves. They were using it because of low self-esteem. They were using it because they had poor coping skills. So that the counseling has to help them to develop new ways of dealing with the old problems, because even though they put down the glass and they stop using the drugs and they stop smoking the marijuana, they will still have issues to deal with. You will still have disappointments. You will still have times when you got angry, times when you became anxious, times when you became depressed, stressed out because of some relationship or incidents happen in life. You understand? Illness, accident. A lot of people turn to use drugs to help them to cope with the loss of their job, loss of a business, things like that. So this is why the counseling is critical. But in conjunction, all right, in my practice, I use counseling. I'm a trained professional counselor. I also use the acupuncture. And I also do this in conjunction. I refer people to Alcoholics Anonymous. And I have seen these three interventional methods can provide an actually complete program of recovery. Now, there might be one or two people who will have to go into a hospital setting if they are hallucinating and all of that to be detoxed. But outside of that, if you have the acupuncture, you have the counseling, you go to the AA meetings, you can do it. In my training, I visited the clinic at South Bronx in New York, and I saw hundreds of people there who were coming in the morning. The clinic starts from very early, from 6 in the morning. You come, you have your acupuncture, it takes 20 minutes. You don't feel any pain. There's 5 little needles you put on your ears, and you sit there quietly in a meditative state, and then you go off to your work. And then you work, you stay on the job, and then in the evening you go to a AA meeting. And that program in itself had been tremendously successful, not only with alcoholics. It was introduced to help people who were heroin addicts and who had moved on to using methadone and cocaine and all of that. It was actually borrowed from a program. The acupuncture was borrowed from a program that a doctor in Hong Kong was using to treat women who were obese, who were overweight. So it can even work for people who are addicted to food. There's a lot of people who they do what is called comfort eating. When we are depressed, stressed out, we have a tendency to eat, and we want sweet things, we want ice cream, we want chocolate, and of course, we put on the weight. And if we never learn how to deal with the underlying issues that is causing us to become depressed or anxious, then we'll have another health problem in terms of putting on weight, and then you find you're hypertensive and diabetic, and you name it. All the rest of things happen. But again, Jason, as we keep talking, time seems to fly. I'm looking at the clock up there, and it says 5 minutes to the hour. And I want to remind our brothers and sisters out there, if you have a question on anything that has been said, you can call me at 671-3040. Yes, if you have a problem with alcohol or drug addiction, I will give you information. As I mentioned earlier on, if you type in my name, Ramnaresh Dwarika, on YouTube, you can access all the programs that have been done in the last few months, a complete set of programs that can help you to develop insight and motivation for recovery. And of course, there are specific problems relating to women and treatment, and we'll continue to talk about that in the next program, Jason. Of course, today we could not have a complete discussion on that, but it's something that I think we need to attend to. So I want to thank you and thank the station, thank Francis as well for sourcing the videos and for hosting the program, and thank the management for giving the time, providing this social service for all our brothers and sisters, not only here in Trinidad and Tobago, but worldwide, because I know the program is also posted on your Facebook page, Radio and TV Jagriti, so listeners and viewers can also access the information there. I want to thank you again, Jason, for
Yes,
hosting.
thank you for taking the time to do this program with us. And yes, addiction is real everywhere and in so many different forms. But the good thing is help is out there. And of course, we live in the digital age, so it's a lot easier now. So until next Thursday, I'm Jason Kalu, saying see you around for now.